A new report from the CDC shows that people are delaying doctor visits out of fear of contracting COVID, and that is having a serious health impact on people with chronic conditions. Joining us today to explain is Dr. Kenneth Adams. He's Chief Medical Officer at United Healthcare Medicare and Retirement Plan of Texas. Welcome to the show, Doctor.
Thank you very much. Glad to be here.
So first and foremost, tell me, what are some of the key findings from this CDC report? This is interesting information.
The most significant finding is that patients with chronic diseases like obesity, lung disease, diabetes, and cardiac disease are afraid to go visit their physician's office for fear of getting COVID-19, and they are dying at 12 times the rate of the normal population. And that's why United Healthcare is working with WellMed to get patients to go see their physicians.
So we have some people at home who may be suffering with these conditions and still skeptical, although they know that they're putting themselves in danger. When do we know it's the right time to go and see our doctor?
If you have one of those chronic conditions, it's probably time to go see your doctor. But if you don't, after you listen to this message, the best thing to do is to call your physician's office and find out when your next scheduled appointment is.
Okay, and there are many concerns still, although the numbers are going down finally. For our safety, although wearing a mask and cleaning your hands should be sufficient, some of us are still in fear. What are the best ways to get to the doctor safely to get the care that we need?
One of the silver linings of COVID-19 has been the advent and development of telemedicine. And I just had one of those visits a couple of weeks ago. It's really convenient. You don't have to drive to the office. You don't have to pay for parking. You don't have to wait in the waiting room. So that's where I would start. And between that telemedicine visit or during that telemedicine visit, you and your physician can determine if you need to come in for an in-person visit. And then the opportunity to show up at your physician's office, many physician offices are providing curbside visits, where you call once you get there, a nurse comes out and checks you in, and then the physician comes out to see you in your car. And if a person needs to actually go into a clinic, physicians' offices are following strict guidelines, mask wearing, social distancing, frequent cleaning. So I would like to allay your fears about going to see your physician, and please go do it.
Fantastic, especially coming into sick season or flu season with the holidays around the corner. You want to make sure your health is at its prime. So for anyone watching, please take the necessary measurements to go and see your physician or practice telemedicine. Even if you're not tech savvy, it's really not as difficult as it seems. Where can we go, doctor, to get more information?
You can go to wellmedhealthcare.com/see-your-doctor and go get your flu shot.
Yes. All right. Well, thank you so much, Dr. Adams, for your time today. We appreciate you, and we wish everyone a safe and healthy holiday season.